Hi, let's talk about acute pancreatitis. This is a very high-yield topic, so pay close attention and stay tuned to learn why acute pancreatitis can be so dangerous. Acute pancreatitis can be very fatal, therefore we need high awareness of this condition in clinical practice. By definition, it is a new appearing inflammation of the pancreas. So how do we identify a patient with acute pancreatitis? Typically, they seem very ill. Classic symptoms include abdominal pain, often in a belt-like pattern. Other patients may only show nausea or vomiting. On physical examination, you may find abdominal distension due to meteorism, which is basically a belly full of gas. Throughout the video, you will understand why and how different symptoms may additionally appear. Let's begin with what causes acute pancreatitis. As a brief reminder, both the pancreatic duct, containing enzymes for digestion, and the common bile duct, which carries bile from the liver, run through the pancreas and then fuse in the head of it to secrete into the duodenum. The pancreas is predisposed to inflammation due to this anatomy. Since it's quite common for people to have gallstones in general residing in the gallbladder, they sometimes can enter the common bile duct and move along the duct, in the end obstructing the papilla, which is the gate towards the duodenum. The problem is that this not only blocks the common bile duct, but also the pancreatic duct. Why is this a problem? Normally, the pancreatic enzymes are only activated in the intestine by cleavage into active forms. But now this can also happen spontaneously if the pancreatic juice remains for too long in the duct. The pancreas begins to digest itself. This is also called autolysis or autodigestion. So remember, acute pancreatitis is therefore typically a sterile inflammation, so it occurs without the presence of an infectious agent like bacteria. Let's move on. Do you know the second most common cause of acute pancreatitis? It is alcohol. The pathomechanism is not yet fully understood, but it is assumed that alcohol, among other things, disrupts the release of enzymes within the pancreas. And again, this leads to spontaneous activation and self-digestion, so acute pancreatitis. How can we distinguish these patients in clinical practice? Acute pancreatitis due to alcohol typically occurs in people with severe alcohol dependence. Patients with a stone in the bile duct endure massive pain, typically on the right side of the abdomen, which is called colicky. It's characterized by a swelling beginning and then it subsides again. It arises from the rhythmic contractions of the common bile duct against the resistance of the stone. It's like the severe pain with a kidney stone. So what do we do now? Patients with acute pancreatitis are always admitted to the hospital. Since the most common etiology is a gallstone, we want to treat the cause and therefore need to remove it. Nowadays, this is done with the so-called ERCP, which stands for endoscopic retrograde cholangiopancreatography. Let's make this very easy. An endoscope is passed through the esophagus and stomach to the main papilla in the duodenum. Then it's cut open and the stone is removed. But why do patients need to stay at the hospital, despite the fact that the stone can be removed quite easily? In some cases, removal of the stone is not sufficient, or there are other causes of acute pancreatitis, like due to alcohol intoxication. You should definitely remember this. Acute pancreatitis is so dangerous because there can be immense loss of fluid due to an uncontrolled inflammation. The inflammation can get out of control so much that the vessels of the pancreas are severely dilated and fluid flows into the pancreatic tissue out of the blood circulation and even into the retroperitoneal space. Do you remember the symptoms from the beginning of the video, such as the belt-like pain? These are caused by the expansion of fluid in the retroperitoneal space. So which further symptoms can additionally be explained by this pathomechanism? The more fluid is shifted into the abdominal cavity, the bigger the abdomen becomes. Clinically, this can present as ascites. If you want to learn more about ascites in general, check out our video on this topic. So the more fluid accumulates, the more organs are affected. The intestines can be compromised and a so-called paralytic ileus can occur. Due to the severe loss of fluid, the entire blood circulation loses fluid. This is very dangerous. Hypotension and hypoxia can occur, and if the kidney is not sufficiently perfused, acute kidney injury develops, which can then manifest as anuria or leg edema. We cannot cover every possible outcome, but many other organs can be affected, and in the end it can progress to multiple organ dysfunction syndrome called MODS, even leading to sepsis, shock, or unfortunately death. So how are patients treated with these so-called edematous cause? When you think of acute pancreatitis, you should remember that fluid substitution is one of the most important aspects in clinical practice. Patients need up to 4 liters of crystalloid fluid. Because of the severe pain, analgesic drugs like ibuprofen or spasmolytic drugs, especially in the case of biliary pancreatitis, such as metamazole, are indicated. Antibiotics are only used if secondary infections occur during the course and are usually not used in prevention of the edematous pancreatitis. Once we've stabilized patients medically, so-called complications can still occur during the healing process. Particularly in the edematous cause that we discussed in this video, pancreatic pseudocysts can occur. Why are they called pseudo? In contrast to true cysts, they are not lined by epithelium. They arise from the encapsulation of the inflammation. So why are they even relevant for you? They can become larger and compress adjacent organs, such as the common bile or the pancreatic duct or the stomach. Then they cause pain or trigger new inflammations. Also remember that they can become secondarily infected with bacteria and cause a severe purulent infection this time. To prevent all of this, they are continuously monitored with serial ultrasound examinations. Surgical removal is not standard, but becomes necessary in emergencies. So remember that one possible complication is pseudocysts, which can later cause symptoms again and maybe become infected. Oh man, what a complex topic. And unfortunately, there's so much more to know about pancreatitis, but we hope we were able to convey the most relevant information to you in this video. Let's try to sum up what we discussed. What should you definitely remember? Acute pancreatitis can be fatal. Every patient is admitted to hospital for treatment. We identify patients mostly by typical belt-like upper abdominal pain, and in the case of biliary cause, by colicky pain near the gallbladder. Further clues are nausea, vomiting, or ascites. Remember that the most important part of therapy is the substitution of fluids in order to mitigate severe causes. Otherwise, multiple organ failure of the intestine, kidney, or even the lung can occur, up to sepsis, shock, or unfortunately death. If you want to learn more about ascites, feel free to watch our video on it to get an overview of what ascites actually is. I hope the video was helpful to you. Feel free to ask any questions in the comment section and leave a feedback. Good luck studying and see you next time.